Deep neural network, DNN, to diagnose patients' health. A deep neural network, DNN, diagnose patients by training the model on medical data such as patient history, test results, example blood tests, imaging results, and other relevant features. Here's how a DNN diagnose a patient. Pradeep K. Suri. Author, researcher, and AI/ML architect. Training an AI deep neural network, DNN, involves several steps, where the model learns from historical data to identify patterns and make predictions. The goal is for the model to make accurate predictions based on new, unseen data. Here's a detailed explanation of the training process. 1. Data collection. The first step in training a DNN is to collect a large dataset that contains examples of input data, such as patient history, symptoms, test results, and the corresponding target, or labels, which represent the correct output, example diagnoses, disease categories. For example, in a medical diagnosis task, the dataset might consist of input features, patient age, blood test results, symptoms, cough, fever, etc., medical history. Target labels, disease categories, example pneumonia, tuberculosis, normal. 2. Pre-processing the data. Data is typically raw and needs to be prepared for training. Normalization/standardization, numerical features, example test results, age, are often normalized to a common scale, example between 0 and 1, to ensure that no feature dominates others due to its range. Encoding, categorical variables, example gender, medical history, are encoded into numerical representations using methods such as one-hot encoding or label encoding. Handling missing data. If any data points are missing, they may be imputed, filled in with estimates, or removed from the dataset. 3. Splitting the data. The dataset is split into 2 or 3 subsets. Training set, used to train the model. Typically, 70%-80% of the data is used for training. Validation set, used to tune hyperparameters and evaluate the model during training, helps prevent overfitting. Typically, 10%-15% of the data is used for validation. Test set, used to evaluate the model's final performance after training. This set should not be used during training or hyperparameter tuning. 4. Building the DNN model. The architecture of the DNN is defined by deciding on input layer. The number of nodes corresponds to the number of features in the input data, example patient history, lab results. Hidden layers, these are layers where the model learns patterns. The number of layers and neurons, nodes, in each layer is a hyperparameter. Output layer, this layer corresponds to the target variable, S. For classification tasks, like disease diagnosis, it may have nodes corresponding to the possible classes, example pneumonia, tuberculosis, normal. Each neuron in a layer is connected to neurons in the next layer, with weights determining the strength of these connections. 5. Forward propagation. Forward propagation is the process by which the input data is passed through the layers of the network. Input layer, the input features are fed into the network. Hidden layers, each hidden layer performs a weighted sum of the inputs and applies an activation function, example ReLU, sigmoid, to introduce nonlinearity into the model. This is where the model learns patterns and relationships. Output layer, the output is produced based on the activations from the final hidden layer. In a classification problem, the output layer typically uses a softmax activation function, which converts the raw output values, logits, into probabilities that sum to 1. 6. Loss function. The model's performance is evaluated using a loss function, which measures how well the model's predictions match the true labels. For classification problems, a common loss function is cross-entropy loss. If the model's prediction is far from the actual label, the loss will be large. If the model's prediction is close to the actual label, the loss will be small. The loss function is minimized during training to improve the model's accuracy. 7. Backpropagation. Backpropagation is a process that helps the model learn by adjusting its weights. After forward propagation, the model computes the loss, error, gradient descent, Backpropagation uses an optimization algorithm like gradient descent to minimize the loss. Gradient descent computes the gradients, partial derivatives, of the loss function with respect to each weight in the model. These gradients tell the model how to adjust the weights to reduce the loss. The weights are updated using a learning rate, a hyperparameter that controls the size of the weight updates. Weight_new equals weight_old, learning_rate asterisk gradient. This process is repeated for each weight in the network. 8 epochs and iterations. An epoch refers to one complete pass through the entire training data set. During each epoch, the model performs forward propagation, calculates the loss, and adjusts weights through backpropagation. The training process typically involves running multiple epochs, example 10, 50, 100, until the model converges, i.e., when the loss no longer improves significantly. 9. Validation and hyperparameter tuning. During training, the model's performance on the validation set is evaluated after each epoch. If the performance improves, the model continues to learn. If the performance on the validation set starts to degrade while the training loss improves, this could indicate overfitting. The model is learning the training data too well but fails to generalize to new data. In such cases, techniques like early stopping or regularization, example dropout, are used to prevent overfitting. Hyperparameter tuning involves adjusting the architecture or training parameters. Number of layers and neurons. Learning rate. Batch size, how many samples to process at once. Activation functions, etc. 10. Evaluation on the test set. Once the model has been trained and tuned, it is evaluated on the test set, which was never seen during training. The test set provides an unbiased estimate of the model's generalization ability, helping to assess how well it can perform on new data. 11. Model deployment. After training and evaluation, the DNN model can be deployed to make predictions on real-world data. For example, a trained model could be used by healthcare professionals to diagnose new patients based on their symptoms, test results, and medical history. Summary of the training process. 1. Data collection, gather a labeled data set. 2. Pre-processing, normalize, encode, and clean the data. 3. Model building, define the architecture, input, hidden, and output layers. 4. Forward propagation, pass data through the network to make predictions. 5. Loss calculation, compare predictions to actual labels using a loss function. 6. Backpropagation, adjust the weights using gradients to minimize the loss. 7. Epochs, repeat the process for multiple epochs to improve performance. 8. Evaluation, evaluate the model on a test set to measure its accuracy. 9. Deployment, deploy the trained model to make predictions on new data. This process allows the DNN to learn complex patterns in the data, making it capable of performing tasks like diagnosing diseases, classifying images, or predicting future outcomes. Thank you.